Good morning, ma'am, and good morning, classmates. Let me introduce myself to all of you. My name is Vicky Camille B. Daguno, third year BEd. I am the reporter of Lesson 7, Risky Behaviors and Adolescents. Our learning objective in this topic, when you finish reading this chapter, you should be able to Number 1, understand the risky behaviors of the growing adolescents. Number 2, identify trouble signs that can lead to risky behaviors and its complications. And number 3, discuss how to avoid risky behavior. Introduction. Majority of the youth matured successfully through adolescence without apparent long-term problems. All adolescents should be considered at risk due to the prevalence of risk behaviors, the inherent developmental needs of adolescents, and the various risk factors for their initiation and maintenance. In today's generation, konti na lang yung mga adolescents na nag-matured successfully. Nakadepende na to sa kanila if magpapa-impluensya ba sila sa maling bagay o sundin nila kung ano ang tama na may magandang dulot sa kanilang buhay. Risk-taking is defined as participation in potentially health-compromising activities with little understanding of or in spite of understanding of the possible negative consequences. As a young individual, it depends on ourselves if we do good or bad. Dito na papasok yung decision making natin as an adolescent. Paano ba tayo na-impluensyahan ng decision natin? During the process of growing from child to adult, adolescents may make choices that could put their health and well-being at risk. Kaya yung mga kabataan ngayon, bigla-bigla na lang sila gumagawa ng desisyon na hindi man lang pinag-isipan kung ano ba ang kakahantungan ng kanilang desisyon. Hindi nila naiisip kung yung consequences na maaaring mangyari if ipagpatuloy pa rin nila ang desisyon na hindi nila pinag-isipan ng mabuti. Adolescents experiment with new behaviors as they explore their emerging identity and independence. The concept of risk has been established as a characteristic that exposes adolescents to treat their health and well-being. Young people may be exposed to similar risk but respond differently. Some may not sustain any physical and emotional damage, while others may be affected for the rest of their lives. That's why adolescents are curious about everything, especially if bago sa kanila yung bagay na yon. Halimbawa, narito yung drugs. Dito na papasok yung decision making ni adolescents. What if pag gawin ko to? Ano kaya ang mangyayari? Sa panahon ngayon, adolescents are risk-taker. They are ready to risk para malaman lang kung ano ang pakiramdam kapag nakagamit ng droga. Slowly by slowly, natututo na si adolescent gumamit ng droga and na-discover niya na ang effect nito. Siyempre, magde-decision pa rin si adolescents if ipagpatuloy niya ba ito o hindi na. So, the consequences na kanyang ginawa is it can affect his life. According to the Department of Health, it is Adolescents and Youth Health Policy 2000 has identified the following health risks: substance use, premarital sex, early childbearing, abortion, HIV/AIDS, violence, accidents, malnutrition, and mental health. During adolescent stage, young people begin to explore health behaviors including smoking, drinking, alcohol, drug use, sexual intimacy, and violence. Guidance of family is also important as the adolescents develop into a mature adult. Family arrangement based on the 26 McCain-Erickson study has noted that 53% of adolescents live with both parents because the Overseas Filipino Worker or OFW phenomenon. 5% live without the mother, and 20% live without the father, and the 23% live without both parents. It is important that we have a parents or guardian that can guide us in the right path. I have a friend named John. Itong si John, hindi masyadong close sa parents niya, tapos ang parents niya is busy sa trabaho, minsan lang umuwi, minsan once a week. Then, lagi siyang pinapagalitan ng parents niya kahit kakarating lang nito galing sa trabaho dahil mababa daw ang grado o hindi pumapasok sa paaralan. Si John takot mag-open up sa kanyang nararamdaman dahil feel niya baka papagalitan lang siya ito. Si John ay nag-seek ng comfort sa mga friends niya kasi nafe-feel niya na pinapakinggan siya sa lahat ng kanyang sinasabi, pero na-impluwensyahan rin siya ng kanyang kaibigan na uminom ng alak at gumamit ng masamang droga para makalimutan niya ang kanyang problema. So, did you see the effect? Ang mga kabataan ngayon ay madali lang maimpluwensyahan, kaya napaka-importante talaga na gabayan ng magulang ang kanilang mga anak. Identified sexual risks that were found among the growing Filipino adolescents are as follows. 1 in 3 has sexual experience. They also engage in sex at younger age. First sex for boys is 17.6 years old, while the first sex for girls 18.1 years old. 1 in 50 had sex before age 15, while 1 in 4 had sex before age 18. 7 in 10 of first premarital sex cases are unprotected against unintended pregnancy and sexually transmitted infection, STI, including HIV and AIDS. A majority of Filipinos favored sex education in all schools. Shows that 17% wants the program to be implemented in our education system. So what are the importance of sex education in the country? Schools should not educate students not only about sex, but also about safe sex practices and pregnancy prevention methods. 1.2 have paid sex and 1.3 have received payment for sex. This is low but above the national average level. 6.7 have engaged in casual sex. 4.1 mostly males have fuck body or FUBU experience. 6.3 have males having sex with males experience. 2.9 of married youth, including those in live-in, have engaged in extramarital sex. Giving birth at younger age has also been evident in the Filipino youth, such that there is a marked increase in teenage fertility in the past decade. 7.1% age 15 to 19 are already mothers. The proportion of women began childbearing increased with age 2.0 or age 16, 3.2, age 19. Teenage fertility is lowest among all regions of the country, while prevalence of sexually transmitted infection like HIV and AIDS are increasing in the youth. As of 2013, 86.7 have heard of HIV and AIDS, with poor understanding being the highest in the country, noting that 3 in 4 think that they would not get AIDS. First sex education are teaching teenage Filipinos safe sex, and it is proven effective tool in fighting the common problem stated above. It promotes ideas such as the right time to marry, the challenge of being teenage mother, and the differences between love and lust. Sex education will open teenagers' mind on the effects of engaging in premarital sex and unsafe sex, and will be daily reminder that there is a proper time and way to do things. So, next, trouble signs among teens. Sexual promiscuity, regular use of drugs and alcohol, repeated violation of the law or school regulation, running away more than once in 3 months, skipping schools more than once in 3 months, aggressive outbursts, impulsiveness, dark drawing or writings, deterioration in hygiene, oppositional behaviors, refusal to work or non-compliance, chronic lateness, falling asleep in class, changes in physical appearance, and excessive daydreaming. If we notice this trouble sign to our sibling, cousin, and friends, hanggat maaga pa, kausapin natin sila at aalamin natin kung ano ba ang kanilang problema, lalo na sa panahon ngayon na mahina ang kanilang mga mental health, because they need a guidance from their parents that can lead them to the right path. Harmful practices. Culture and tradition play a significant role in shaping the way young people and adolescents behave and lead their lives. However, young people have become victim of some harmful traditional practices which affect their human and productive rights. These practices differ from place to place but primarily affect women. Common drug abuse by young people and their effects. Number 1, marijuana. Number 2, mayrunggi. Number 3, alcohol. Number 4, cigarettes. Number 5, cocaine. Number 6, heroin. Number 7, amphetamine. Number 8, ecstasy. And number 9, inhalants and solvents. Marijuana, also known as cannabis, grass, joint, spliff, hashish, pop, pot, and weed. Marijuana is a plant grown and used worldwide. Usually people smoke the leaves, but the leaves and the stem can be made into tea or even cookies. So, some people become relaxed and happy while if people take marijuana, so they feel relaxed and happy while others feel panic or fear. User eyes usually become red and their throats and mouths will be dry. Appetite may increase. So, the effect of marijuana causes increase in heart rate and dilation of certain blood vessels in the eyes, which creates the characteristic of bloodshot eyes. Chronic bronchial irritation is one of the long-term effects of chronic marijuana use. Other potential adverse effects include impairment of long-term memory, gum disease, increased risk of cancer of the mouth, jaw, tongue, and lungs, and impairment of the immune system. Some studies have suggested that long-term marijuana use may result in decreased testosterone levels, decreased sperm counts, and increased sperm abnormalities in male users. Heavy marijuana use during pregnancy may cause impaired fetal growth and development. Mayrunggi, also known as cat or mira. Mayrunggi is the common name for the stimulant leaf that is chewed in the much of East Africa. Chewing mayrunggi can help someone feel more awake, confident, and energetic, and can also reduce hunger. In fact, many students in East Africa use it when cramming for exam. So, one of the effects of chewing the leaves of mayrunggi is including the sleeplessness, anxiety, aggressive behavior, and hallucination. Some men are unable to get an erection after they have been chewing. Alcohol is the most common drug and is used worldwide because it is legal, often kept in the home, and comes in extremely cheap local brew. Alcohol is extremely easy to find and consume. At first, alcohol causes relaxation and people feel less self-conscious. After more alcohol, an individual gets drunk, reaction time slows down, and thinking straight becomes difficult. This is why people who are drinking are often involved in the car accidents. So, the effect of drinking alcohol can cause slurred speech and aggressive behavior that can lead to fight, rape, or other kind of violence. People who consume too much alcohol can end up vomiting, become unconscious, or even dying because both young men and women often lose their inhibitions when drinking. A girl might have unsafe sex with someone she does not know, and a boy might decide to force someone to have sex. Of course, the consequences of this alcohol-based decision can be very dangerous, even life-threatening. Cigarettes. Cigarettes are also known as tobacco and cigars. Many young people start smoking tobacco products for different reasons, including influence of brands, seductive advertisement, and older roles models like siblings, celebrity, Young people find smoking a cool thing to do, but they become addicted to one of most addictive and dangerous substances, nicotine, which is an active ingredient in tobacco. So the effect of smoking smoking a cigarette. So according to WHO 2006, tobacco is the second major cause of death in the world. Nicotine, which is found in tobacco products, including cigarettes, is highly addictive. The tar in cigarettes increases a smoker's risk of lung cancer and bronchial disorders. The carbon monoxide in smoke increases the chance of cardiovascular diseases. Inhaling smoke possibly causes lung cancer in adults and greatly increases the risk of respiratory illness in children. Cocaine, also known as crack, coke, C, Charlie, nose candy, tooth, bazooka, big C, cake, lady, stardust, cocoa, flake, Mr. Coffee. Cocaine is prepared from coca leaves, which are greenish yellow leaves of different size and appearance. Cocaine is often called the champagne of drugs because of its high cost. So it makes one so if someone take a cocaine, so they feel that their body is going very fast, their heart races, and the high and lows are sudden. Crack, which is smoke, is a much stronger form of cocaine. Cocaine usually comes in a white powdered form, and crack looks like hard white rocks. It is usually snorted up to the nose, and it can be injected or smoked. So the effect of cocaine is the small amount of cocaine will raise the body temperature, make the heart beat faster, increase the breathing rate, makes you feel overconfident, and make you more alert with extra energy. When crack is smoked, all of these feelings are intensified. Excessive doses may lead to convulsiousness, seizures, strokes, cerebral hemorrhage, and heart failure. Long-term effects of cocaine or crack use will lead to strong psychological dependence and other health problems like destroying nose tissues, reportorial problems, and weight loss. Heroin is also known as hammer, horse, H, junk, nod, smudge, skag, white, beige, white lady, white stop, joy powder boy, hairy, Harry, joy powder. So, dami niyang tawag, no? Heroin is a drug obtained from morphine and comes from the opium poppy plant. Heroin is a drug that slows down the user body and mind. It is a very strong painkiller and can be one of the most dangerous things to mix with other drugs. So, heroin usually comes in a rock or powdered form, which is generally white or pink or beige in color and could also come in dark gray, medium brown. So, heroin can be injected, snorted, smoked, or inhaled. This last method is also called as chasing the dragon. One of the effect of heroin, no, when you injected it, heroin provides an extremely powerful rush and a high that usually lasts for between 4 to 6 hours. The effects of heroin included a feeling of well-being, relief from pain, past physical and psychological dependence, sometimes nausea and vomiting, sleepiness, loss of balance, loss of concentration, and loss of appetite. An overdose can result in death. One of the most dangerous effects of injecting heroin is the increased possibility of contracting AIDS. A lot of the time, people who inject heroin use each other's needles, and this is the main source of infection. Studies ha- Studies have also shown that people who are high on drugs tend to have unprotected sex. This too puts the person at risk of getting HIV. Amphetamines, also known as speed, ice, browns, footballs, arts, Hearts, oranges, make wake-ups, black beauties, crystal meth, crack meth, cat, jep amp, dexys, keepers, bennies, browns, greenies, or pep pills. Amphetamines are stimulants that attack the person's system by speeding up the activity of the of the brain and giving energy. Ice is a strong type of amphetamine and is very similar to crack. Amphetamines are man-made drugs and relatively easy to make. Usually, they are white or light brown powder and can also come the form of a pill. Ice is usually comes as colorless crystal or as a colorless liquid when used for injecting. It can be swallowed, snorted, injected, and smoked. So, if someone take an amphetamines, so the effect of using it is increasing the heartbeat, faster breathing, increased blood pressure, and the body temperature, sweating, make the person more confident and alert, give him extra energy, reduce appetite, make it difficult to sleep, and might to make the abuser talk more. The person using amphetamines may also feel anxious, irritable, and suffer from panic attack. Frequent use can produce strong psychological dependence. Large doses can be lethal. Ecstasy, also known as ecstasy, Adam essence, MDM, MDMA, XTC, Eve, MDE, MDEA. Ecstasy belongs to the same group of chemicals as the above category, that is stimulants, and it's most often used in the form of tablets at rave party. So, ecstasy is a drug that speeds up the user system by increasing his physical and emotional energy, like amphetamines. Ecstasy is also a synthetic or man-made drug. Ecstasy is usually a small colored tablet. These pills can come in very many different colors. Some ecstasy tablets have picture on them such as dove, rabbit, or champagne bottles. The color or the brand of the tablet is usually unrelated to the effects of the drug. Ecstasy tablets are usually swallowed. So if the person use ecstasy, so they probably feel happy, warm, loving, and more energetic. He would feel emotionally close to others and might to say or do things that he usually would not. Nausea and vomiting, rise in blood pressure and heart rate, possibly even death due to overheating of the body, and dehydration of loss of water are some effects of ecstasy. Feelings of depression and tiredness are common after stopping the drug. There is mounting evidence that prolonged ecstasy use can lead to brain and liver damage. Inhalants and solvents. Inhalants and solvents are chemicals that can be inhaled such as glue, gasoline, aerosol sprays, liquid fluid, and etc. These are not drugs as such and are, in fact, legally available from a large number of shops. However, they are abused widely by the poorer section of society, particularly street youth. Inhalants can look like almost anything like glue, paint thinner, gasoline, lighter, cleaning, cleaning fluids, and etc. This usually comes in a tube or bottles. Often, the chemical is placed in the bottom of the container and then placed over the nose and mouth. Other methods include soaking a rug in an inhalant, placing the rug in a bag or sack, and then place the bag and inhaling the vapors. So one of the effects of inhalants may give the user a high for a very brief period of time. They may feel numb for a short period of time, dizzy, confused, and drowsy. They can also cause headaches, nausea, fainting, accelerated heartbeat, disorientation, and day hallucination. They can damage the lungs, kidney, and the liver in the long term, can also cause suffocation, convulsions, and comas. Tips to avoid drugs. You don't need to take drugs to be liked by other people. Don't be scared if other people doesn't like you. Don't adjust yourself to be liked by other people. Stay who you are and there are someone can appreciate you. You don't need to take drugs to feel brave or courageous. I know when you take drug you feel brave, but you can feel brave even you don't use a drug. When life gives you something that makes you feel afraid, that's when life gives you a chance to be brave. You do not need drugs to cope with sorrow, accept or disappointment, but never lose infinite hope. You have inside you the strength and inner resources to deal with any problem. Never forget God is bigger than any problem you face. When it's hard to carrying on, just know God will carry you through. God doesn't give us a problem without a solution. Have faith in Him. So this is the end of my report. I hope you understand my video presentation. Thank you for listening, ma'am, and thank you, classmates.